Let's go to Matthew Fitzgerald with the story.
What smells like maple syrup and affects up to 185,000 infants per year? That would be branch-chain keloacidoria, or as others call it, maple syrup urine disease. Maple syrup urine disease is an autosomal recessive pattern located on the 19th chromosome, meaning both copies of the gene in each cell must carry the mutation. Each parent must carry a recessive copy of the gene. This all means that your infant's urine will smell like maple syrup, and if left untreated, could lead to brain damage, coma, seizures, and eventually death. What this all translates to is that you can't process certain protein blocks properly. And now, Tanner, with a story that's very close to our hearts and close to our homes.
Thank you, Matt. The first case ever to appear in Pennsylvania belonged to the Burkholder family. Parents John and Verna from Fleetwood, Pennsylvania had 12 children, and half of them had maple syrup urine disease. Erla was their first child, and her case was most infamous. The disease was very new to that area. Erla was born on January 23rd at 7 a.m. It was a very normal birth. As days went on, she became lethargic and refused to eat. Things became worse when she began to have seizures. This is when a nurse at Reading Hospital mentioned Erla may have MSUD. She then was transferred to a hospital in Philadelphia. Erla was confirmed to have maple syrup urine disease. She was near death, and her family may have had to make the decision to pull the plug on her. But Erla, after receiving treatment, made a quick recovery. This is a very inspirational story and close to our hearts and close to our homes. Here's an expert on the topic, David Yasport.
That's Dr. Damon, you. Now, when I get a patient that potentially has maple syrup urine disease, I first check for these telltale symptoms. Poor feeding, vomiting, lethargy, developmental delay, and of course maple syrup smelling urine are some symptoms. If they do have these signs then, I will prescribe a special medical formula as a substitute for milk. This formula adds nutrients and protein. I advise that parents prevent their kids from eating cow's milk, fish, or cheese. Thiamine supplements can improve your condition, and if all else fails, you may need a liver transplant.
Thank you, Dr. Damon. Could you please explain this chart for us?
Well, of course, Tanner. MSUD is an autosomal recessive disorder, meaning it's non-sex linked and it's recessive. Each parent must have at least one recessive allele. When a parent is heterozygous and carries a dominant and recessive allele, they are called a carrier. Once the two parents who carry the recessive copy mate, the mutation will pass to their children.
Wow, that's a complicated chart. Think you could explain the second one to us, Doc?
You bet I can.
Well, could you?
Sure thing. Well, you see, when a child with maple syrup urine disease, or MSUD, has a defective BCKD protein complex, so as the chart says, proteins will be broken into amino acids. 3 of these acids will be leucine, isoleucine, and valine. Now, a child with MSUD's 3 amino acids will be toxic and can't process properly.
Goodbye.
Goodbye.